All right, recording whenever you're ready.
All right. This is Dr. John Wycoff, another podcast of exciting learning and opportunities for you to improve your health and wellness naturally with pathways to wellness with yours truly, Dr. John Wycoff. I am an integrative functional medicine specialist. My training is in family medicine. I come from the conventional world, but I've ventured into the world of functional medicine, which really looks at you individually and does the right testing to find the root cause of chronic medical conditions. So we're going to talk today about something that I think is very exciting. It's called microdosing of GLP-1 medications. So just to orientate you a little bit, you may have heard the term GLP-1. That stands for glucagon-like peptide number 1. These are medications that have hit the market actually about 8 years ago. And there are 2 of them that are mainstream today. Semaglutide, that goes by the trade name Ozempic and Wegovy, and tirzepatide, which goes by the trade name of Mounjaro and Zepbound. All 4 of those drugs work in a very similar fashion. They are all GLP-1 agonist medications, means they bind to the GLP-1 receptor. And they're helpful, and they really have revolutionized the way we treat metabolic disorders, type 2 diabetes, PCOS, hormonal imbalance, depression, addiction, and also have been shown to reduce your risk of heart disease, stroke, cancer, depression, addiction, and maybe even dementia. So it's a really exciting class of medication. It's constantly changing, and we're going to keep today's discussion about microdosing, and we'll talk about what that is, of GLP-1 drugs, whether it's semaglutide or tirzepatide. We can microdose any of them, and we're going to talk about some of the pros and the cons of that and how you might want to consider microdosing as an option for you. So microdosing GLP-1 means simply starting at a lower dose than the standard guidelines recommend. The pharmaceutical companies, in conjunction with the FDA, have come up with guidelines for these medications. And they have recommended dosing, and usually the schedule starts out with a low dose and escalates up every few weeks until you get to what they consider a therapeutic dose. Microdosing really abandons that premise. So since we're microdosing, we really don't have a lot of guidelines from the FDA as to what we should or shouldn't use. So you really have to find a physician, a practitioner who is skilled and has experience with these medications. These medications, I'll be honest, are not for the faint of heart. There are side effects, and no matter what you read, I will tell you that almost every patient I start on GLP-1 drugs, and I've started over 400 in the last 7 years, have side effects. Now, of those 400, I've only had 3 or 4 have to stop because the side effects were very significant. Most of them get through that, or we help them through that by changing the schedule, the dosing, etc. But you need help, and you need a practice that will support you. So this is the problem when people try to go on websites like Roe or His and Her or whoever has the latest promotion on GLP-1 injections, is you just are not going to get the support you need to be successful in your journey. So find someone like me who really embraces GLP-1 drugs, uses them, understands them. So the goal of microdosing is to allow the body to adapt slowly, minimizing side effects. Those side effects can include nausea, can be fairly significant, fatigue, bloating, constipation, diarrhea. Also, you'll see a reduction in appetite. You'll see improved insulin sensitivity and a lowering of your blood sugar if it's elevated. These medications do not do much to lower blood sugar if your blood sugar is normal. So when we microdose, we're using a smaller dose. That doesn't mean we don't increase the dose. It just means we use a smaller dose than you typically would find or be recommended. Many people have to stop GLP-1s, or some patients, because of the nausea, the reflux, constipation. At a microdose, that is much less likely to happen. So we can titrate that dose down even below the initial starting dose if needed. Microdosing avoids the intense appetite suppression, or sometimes what people say is the food noise goes away. It can be almost an aversion to eating. And also, if you're a regular consumer of wine or liquor, most people find that desire goes completely away. They just do not want to drink anything. So we see less of that on microdosing, but it still happens. When we start at low doses, GLP-1 help correct blood sugar. So if you do have some insulin resistance, maybe your doctor said, well, your blood sugar is kind of borderline, or you're pre-diabetic, or you have metabolic syndrome, PCOS, things like this. This will help that. It'll help normalize your numbers. It'll help improve, stabilize blood sugar swings, improve your moods, and et cetera. So we start with a very low dose of semaglutide in our practice. We can also use tirzepatide. Part of the issue is how to make this work. And what the pharmaceutical companies have done with Wegovy, Mounjaro, and Zeptide, those three come in single-dose auto-inject pens. The pens are very nice, but you can't microdose with any of the pens other than the standard starting dose, 0.25 of semaglutide, Wegovy, 2.5 milligrams of tirzepatide, usually Zepbound, or Mounjaro. They're exactly the same drug. So with semaglutide, we can start patients on a auto-injectable pen with the medication Ozempic, the same medication as Wegovy. But the pen has a dialable dose, and I didn't bring one in today, but we can dial the dose to different amounts, and we can control how much you're getting. So we can start you at a lower dose and then titrate you up either based on how well you tolerate the medication, how you're feeling, how much weight you're losing, what your goal is, etc. So the normal starting dose of semaglutide is usually 0.25 milligram. We often start people at half of that, or even a little less, 0.05 to 0.125 milligram for at least a 2-week period of time. And then we increase their dose if needed. There again, you're going to be monitored by our practice, by me personally at Wycoff Wellness. We're going to get the right testing, blood testing beforehand. We're going to try to identify any barriers you have for weight loss, whether it's hormones, thyroid, underlying infection, things like this. Try to correct those. We're going to try to get the cards stacked in your favor. I tell people that losing weight is hard. When you're trying to run uphill and lose weight, if you have barriers, it's like running uphill all the time. It's harder than just running. So we're going to try to level the field. The slow increase of semaglutide or tirzepatide reduces the risk of unpleasant side effects and allows for more control. We'll monitor those labs, hormonal markers, clinical symptoms to get you to the optimal dose. And oftentimes it's a very small amount of medication. Now, what we're able to do is we can get compounded forms of semaglutide and tirzepatide for you. This comes in a vial, and you inject a small amount either into your abdomen or your thigh once a week. What the vial does for us, it allows us with the syringe to individualize your dose, and it makes microdosing very easy, very practical, and actually quite a bit less expensive than the name brand medication. So if we can't get to a standardized dose, let's talk about Wegovy. Wegovy comes in auto-injectable pens, 0.25 milligram, 0.5 milligram, 1 milligram, 1.7 milligram, 2.4 milligram. If we can't get you on one standard dose, with the compounded vial form of semaglutide, we can show you exactly how much to take on the syringe, You inject it once a week, and it's the exact same ingredient as the name brand drug. It's just in a compounded form. So that can be a really great choice to help you with compliance and finding the dose that's optimal for you. One of the advantages of compounded medications is that we can individualize your dose. We can get you on the dose that works best for you. That dose may be 0.3 milligram. Well, they don't have a 0.3 milligram Wegovy. It's either 0.25 or 5, and you can't change that. It's in a pre-measured auto-injectable pen. It all goes in or none goes in. So when we go to compounding and we have a vial and a syringe, and the needle is very, very small. The needle is about the size of the tip of my pen, even smaller than that. It's a microfine needle. Most people don't even feel it. I've had people with significant needle phobia be able to inject themselves with Wegovy or compound of semaglutide or tirzepatide. Now, which one's better? I think the one that works for you is best. So I have many patients that go from semaglutide and they may go to tirzepatide, may go back. We see comparable weight loss and the side effect profile is identical with both semaglutide and tirzepatide. So we use semaglutide because I'm able to get a sample pen from the Ozempic people that allows us to dial up the dose. And we can start you on microdosing very easily, titrate you up to the point that we need to get you a prescription. We know what that amount is, whether we get you a prescription of Wegovy or a prescription of compounded semaglutide. If we want to convert you to tirzepatide, we can do that. We have a process to do that. So, who should do this? Well, if you want to lose weight and you're not an insulin-requiring diabetic, even if you only got 20 to 30 pounds to lose, this may help you. If you've got weight to lose, most likely you have some degree of insulin resistance. That's resistance to the hormone insulin. This is the only medication we know that will modulate or change that. Why do you get insulin resistant? Well, number one, you live in America. Living in America puts a lot of barriers up. Big food does a lot of things to make insulin resistance continue. Foods that are highly processed, ultra-processed, high in sugar, high in high fructose corn syrup, high in corn oils. These things all promote insulin resistance. And the more resistance you get as you get older, or if you have genetic predisposition, you're going to develop increasing blood sugar. I always tell people to look back over time if they have the ability to do that on previous labs. And a lot of the hospital portals will allow you to graph your blood sugar, which is going to be obtained at every physical you get by your doctor. And look at what your blood sugar's done from 10 years ago, 20 years ago to today. We always do blood sugars in our office fasting, and that's really the only way to make a reliable comparison. But I can imagine that if you're 20, 30, 40, 50 pounds overweight, and you have the ability to go back and track your blood sugars, you will find that 10 years ago, 20 years ago, your blood sugar was probably exceedingly normal. Maybe it was 85, 90. And then if you look at it over the years, it probably slowly snuck up. Your doctor would have told you everything was fine. It was 92, 94, 98, all normal. Anything 99 and below is considered normal. Yet the question should be, well, why is my blood sugar increasing? Even though I'm normal, I've gone from 85 to 95. And then lo and behold, a year or two later, you're at 105. And your doctor says, well, you got a little bit of prediabetes, glucose intolerance, maybe metabolic syndrome. I'm not diabetic. No, you're not diabetic. Diabetes by definition is blood sugar above 126 milligram percent. Well, this is part of the farce of conventional medicine. When you were going up from your initial number of 85 or whatever it was, you were developing some early signs of diabetes. And really the time to intervene would have been when your blood sugar was 90 or 95 or 98 or 105. But conventional medicine will wait until you're at 127, 1 point above the threshold of 126. So 1 year you're at 124 and the doctor says, well, you're pre-diabetic. Watch your diet, lose some weight. You come back a year later and maybe you've done those things. And he says, well, now you're at 130. Well, you're diabetic. Now you got to be on medication. Well, you had diabetes the year before. Your doctor just didn't call it what it was. It's just ludicrous how conventional medicine looks at hyperglycemia, diabetes. So you'd be a perfect candidate for a GLP-1 drug to do two things. One, to help you lose those 20 to 30 or 40 pounds, which you could do safely, effectively, efficiently, without starving yourself with the GLP-1 drug. You would feel good. You reduce your risk of heart disease, stroke, cancer, dementia, depression. Your blood pressure will go down, your cholesterol will go down, and your weight will go down. Now, it may take 6 months, 8 months, but really at the end of the day, do you care how long it takes to get down to a goal weight if you just see your weight start going down? Because I know what many of you have struggled with, just as I've struggled, and many people struggle, is that every year your weight goes up 5 pounds despite doing what you think you should be doing. You're eating healthy, you're reducing your carbs, you're exercising, and lo and behold, the scale will not budge. GLP-1 drug is something to think about. It can be used safely. It's powerful. You don't need to use this aggressively. You can microdose. I think that this is very much a functional medicine drug. People sometimes question, they say, well, Dr. Wycoff, you're into natural solutions, and I am. But if you really understand how a GLP-1 drug works, it really gets to the root cause of your weight gain and your blood sugar issues. It's insulin resistance. It helps us rebalance, and it gives us what we need to get back to balance. So in summary, the GLP-1 drugs are a hormone glucagon-like peptide 1 used to help manage blood sugar, reduce appetite. You'll feel fuller. You'll lose weight. Initially, GLP-1 drugs were approved for diabetes. Now they're approved for weight loss. Microdosing allows us to use smaller doses than our standard recommended dose that the manufacturer recommends. We can use microdosing either with the actual pre-filled pens, or we can use compounded. We can get the compounded medication for probably as little as $150 to $200 a month. Question always comes up, can I stop the medication? And, my answer to this has evolved. When I first started prescribing the medications, I really told people, plan on staying on the medication long term. I'm doing more now cycling of microdosing, where I'll put people on the medication for 3 or 4 months, take them off for 3 or 4 months, see how they do. And oftentimes we can do that cycling on and off. That reduces the cost, reduces the side effects, and effectively manage your weight, especially if you're not a diabetic. If you have type 2 diabetes, I think that it's a little more challenging. Genetically, your elevated blood sugar is going to want to come back if you start going on a regular diet. But if you couple microdosing GLP-1 with modest diet changes and exercise changes, you'll lose weight. What do those diet changes involve? I try to put people on a very high protein diet. You can go to Dr. Google and just Google high protein diet and follow it. What do you give up? You give up breads, pastas, so simple carbs, sugar, alcohol. You eat nutrient-dense vegetables, broccoli, asparagus, cauliflower, Brussels sprouts. You eat lots of protein. You can have eggs, bacon. You don't have the toast for breakfast. You have salad for lunch with some turkey or chicken. You have a meat, fish, beef, chicken, veal, a dinner with a vegetable, not potatoes. You have a nutrient-dense vegetable. Maybe you have a little blueberries for dessert. And you'll lose weight. Get out and walk 30 minutes a day. You'll be amazed if you start to move, eat a high-protein diet, get on a GLP-1 drug, how simple this can be. Now, I can't give you an FDA study that endorses microdosing. I don't think they will do one. They want doctors to be very much in the regimen of escalating doses. So I don't have the ability to do that. But what I can tell you is that microdosing is a tremendous way to help you if you need to lose weight, or if you have a metabolic disorder like metabolic syndrome, where you have borderline high blood sugar, maybe borderline high blood pressure, high cholesterol, high triglycerides, and maybe weight around your belly. This is an amazing class of drugs. And I don't say that about very many medications in my entire career. I've been doing this for 40 years. This is just an unbelievable class of medication. And we can use this even in someone who's significantly overweight. Let's say you have 100 pounds to lose. GLP-1s can be part of that. Now, we might put you on more than the typical microdose patient to get you losing weight. And we may also put you on a more regimented diet. I've got some ideas about intermittent fasting and bone broth diets that really can result in significant weight loss over a quick period of time. But here again, you need to do this with a doctor who understands it, who can help you get through the barriers and get you successful. We need to monitor the blood tests. And all of our patients who would do GLP-1 drugs, microdosing, regular dosing, makes no difference. We get a complete comprehensive blood panel before we start. We're going to understand what your blood chemistries are, what your blood sugar is, what your kidney liver function is, what your blood count is, what your thyroid hormones are, what your female or male hormones are doing. We're going to understand your HbA1c, your average blood sugar, your fasting insulin. We're going to have all those numbers for baseline. And those are powerful numbers to look at and compare as we move forward. And you can begin to see the changes. You can take charge of your life. You should be taking charge of your numbers. Get a doctor to help you get the right testing done and learn more about GLP-1 microdosing. You can learn more by contacting us at the Wycoff Wellness Center. We're at 1226 Michigan Avenue in East Lansing. We are just east of Sears and Frandor, west of the Harrison Roadhouse, right on the corner of Michigan and Highland. You can call us at 517-333-7270, 333-7270, or 800-471-0255, 800-471-0255, wycoffwellness.com, WYCOFF wellness.com. Call our office, stop by. We have some of the best nutraceuticals for sale in our office, or you can buy them online at wycoffwellness.com. We do a lot of promotions. If you get on our mailing list, we'll help you with save some money. And you can learn more by listening to this podcast. Please like it and follow me at Pathway to Wellness with Dr. John Wycoff. Thank you for listening.